I'm a consultant plastic, reconstructive and aesthetic surgeon, and I've been performing cosmetic breast operations for over 25 years. Now, in that time, I've witnessed the development and advances in technique for this procedure. Over the years, I can say that I've seen many patients who've achieved a really worthwhile improvement in the profile of the bust, thereby gaining in self-confidence. And it can really help to enhance and for some restore a sense of femininity. In years past, all we had to do was decide on the size of the implant, but today there are so many more choices to consider, and I will guide you through these. The options that need to be discussed include the approach and therefore the scar, the pocket into which the implant is going to be placed. Will it be under the breast gland? Will it be under the muscle, or a combination? The combination depends to a degree on age and your own specific size and shape in your bust. But I will discuss what's best for you depending on what you are trying to achieve. I prefer to use micro-textured and nano-textured cohesive gel implants. The nano-textured implants are relatively newer, but they're thought to remain softer in the body for much longer. Now, for any woman considering breast augmentation, I like to undertake a thorough, in-depth consultation. This is essential so that you as the patient and I as your surgeon, that we're both singing from the same hymn sheet, so to speak. And that what I think you want is actually what you want to aim for. Nowadays, it's not just about the size, but also the shape. And not just about the shape, but also the profile. Do you want to look very natural? Do you want to have more fullness at the top of the bust? What about your breast width, your height, the chest height, and so on? I'll usually discuss with you the types of implant gels, what the implants are covered with in terms of the surface. It could be smooth or textured, nano-textured. I'll also undertake a detailed assessment, including measurements, and these are invaluable to help us together to guide us to the best shape, the best profile, the best type of implant, individualized for you. Of course, I'm going to help guide you through this, but normally by the end of our consultation, we'll have agreed on a broad outline of size and shape. I'll provide you with some documentation, including a practical guide to allow you to come to an informed decision regarding the volume of the implant and the shape. Then I'll meet you for a second time, at which point we should be ready to finalize implant decisions. There are risks to any procedure, and I always undertake a thorough discussion regarding the pros and cons of the procedure, and also the implants themselves. Breast implants have been used since the early 60s, and they have a long history of safe use. But since first introduction, they've gone through a number of changes, modifications, improvements. The major risks of implants include rotation, rupture, and contracture. Contracture is the firming up of the shell the body weaves around the implant as part of the healing process. There have been a number of controversies with breast implants over the years, and there are some risks that are rather rare, but I will discuss everything with you, and you'll find links to more information on the website. I can assure you that everything will be discussed, and I will explain why I choose the range of implants that I do. I only use the highest quality implants with a long, tried and tested history. These days I tend to use micro and nano-textured implants, which are thought to remain softer for much longer. Breast augmentation surgery is normally performed with the patient asleep. It takes about 1 to 2 hours with a single overnight stay. Once you've gone home, usually at about a week, you'll be seen by one of our specialist nurses and by myself, usually about 2 or 3 weeks, then at 6 weeks and at 12 weeks, or until you and I are both satisfied with respect to the outcome. After surgery, activity needs to be restricted early on, but I'll guide you on what you should and shouldn't do. It's important, however, that you allow yourself the time and space to heal. You will then often heal and get back to normality quicker. When I place breast implants, I place them with a view to them lasting a lifetime. But an implant is it's a medical device placed inside the body. And just like other medical devices, like a hip replacement, depending on your age, your lifestyle, your health, they may not last a lifetime. A number of authorities suggest that implants should be replaced at 10 years, but personally, I don't replace them unless there's a specific problem. Some implant manufacturers now provide implants with guarantees of longevity or against rupture and even contracture, hardening of the implant.